I'm Omar Shakir. I practice in Greenwich, Connecticut. I founded Coastal Eye Surgeons 3 years ago, and I started as a cataract and retina surgeon. I started my practice wanting to be a leader. I didn't want to follow the footsteps of everyone else, so fresh out of fellowship, I had a different idea of how to offer medical care to my patients. I wanted to be a boutique practice. In naturally office-based surgery, I have the most control over all the variables that go into how surgery is done. So it was natural for my practice. The first I had heard about iOR partners was a couple years ago through a Google forum of solo eye doctors where we all kind of share information on our practices, and it's a closed group, so we're more open with these types of things. And someone had mentioned iOR partners. I looked into it. Talking to Rick and Tony, they made me feel extremely comfortable. They're veterans in the field, and they've done this before with ASCs, and now it's time, I think, to move into the office. And their mantra about going about it, I believe in strongly, and I've been an advocate ever since I met them. What I love about it, what appeals to me the most, is that surgeons take the lead. So that is something that people think we have in an ASC setting or a hospital-based surgical setting. Not necessarily the case. I'm another cog in the wheel a lot of times. I show up to do my surgery, but I don't have a lot of control or influence over my patient's experience from when they hit the door to when they leave. Obviously, I control the surgery, but that's about it. In this environment, I control everything from the minute they enter the door, what their experience is like being prepped for surgery, how they're made to feel less anxious, how we can make them feel, and the medications I use, the way I do surgery, the technology I use, the equipment, post-operative care, how I involve my staff in it. And they understand that. They've seen and probably heard the critiques from surgeons and internalized that and said, not only is this better for the patient, but it's better for the surgeon, which in turn is better for the patient because we can control the things that we know improve outcomes. Right, patients who come in the office have come to love the office. There's a reason why they keep showing up. They love the office, they love the staff, they love the environment. It's comfortable and it's convenient. And we extend that comfort and convenience into the surgical setting because it's the same office, same staff. They obviously know me, and they know the kind of quality that I offer in my office when I have high technology and thorough attention to detail and the bedside manner that we show them. That carries forward right into surgery, and there's nothing different about it. So the biggest benefit to patients, convenience, but also that spawns less anxiety, that leads to more trust in the whole system, in the physician, in the surgery. They're more willing to go forward with it and feel confident in their decision.